Welcome to Adapt NCLEX. Most nursing students know psych content, mental health content, or the concept. But what is the problem? The NCLEX or nursing school test judgment. In this video, we're going to practice high-yield psych SATA questions. This is select or apply questions. And by the end of this video, you learn content regarding this psych issue. And when you see a SATA question, it's just asking you about your content at the same time, clinical judgment. Let's get to it. As usual, stop the video, answer the question your own, and then keep your score and see the way I'm going to approach it. It's a select or apply. What you do, read the question from the back. When you read the question from the back, you will know what the question is asking. Select or apply. It means don't over-select. It can be all the answers may be right, but pay attention. Pay attention to your content and pick those that you are 100% confident. Which actions are required? That means you got to do it. And let's apply what? A restraint to an aggressive client. That means an aggressive client had a restraint placed. What do you do? That's all. Obtain a provider order. Use restraint as needed. Document the reason for the use. Check neurovascular exams every 2 hours. Apply the restraint indefinitely if behavior continues. Or try least restrictive measures first. What do you think? The patient is aggressive. What are you going to do? Which of this is required? Once again, stop the video, pick your answer, and let me know. But this is the way I approach it. You need an order from the provider. After you place the restraint, use a restraint as needed. Negative. Restraint cannot be used as a PRN medication. You have to need it. You need the order, and you need to work with it, how long you're going to use it. Therefore, you're going to document the reason why you need it and why you have to use it. You don't just lift it on. You got to remove it and do a neurovascular check every 2 hours. Make sure patient is okay. If after 2 hours you don't need it, you take it out. But you have to check and make sure patient is okay. You don't apply a restraint indefinitely. That's why you need an order. The doctor is going to tell you specifically how long you're going to use it. And if you got to try, always use least restrictive. Least restrictive, talking to the patient. Patient is aggressive. Try not to use the restraint as much as possible. Therefore, those are your right answer. You get it? This is ethical, legal questions apply to restraint. So you got to use it. Number 2, you know this. You've seen this before. Like I said, this is content, but this is a trap. Don't get trapped. Select or apply. Which finding indicate alcohol withdrawal? The buzzword is alcohol withdrawal. I'm leading you to the answer. 24 hours after last alcohol intake. A nurse is assessing the client 24 hours after last alcohol intake, which finding indicate alcohol withdrawal. Select or apply. Lethargy, diaphoresis, bradycardia, hallucination, hypotension, tremor. What do you think? Stop the video. Keep your score. Put it in the comments. Let me know. You pick an answer? Now let's get to it. What is the question is going to ask you? We're going to break it down. The question is asking, patient, which of these indicate alcohol withdrawal? But you have to pay attention. There's a buzzword there. And this is assessing the client 24 hours after the last dose. So they give you a time. 24 hours is early signs of alcohol withdrawal. And therefore, I'm looking for answer choice on early signs of alcohol withdrawal. Alcohol withdrawal itself, because it's a downer, it's a substance abuse medication. Therefore, if you take it, since it's a downer, you're going to go down. If you don't have it, your symptoms goes up. So withdrawal means I'm looking for things that are going up. That's the first thing. That's the first clue. Therefore, lethargy is gone. Even though it's a bad thing, it's talking about withdrawal. It's not sedation. It's not intoxication. Diaphoresis, we're going to keep it. I'm showing you strategy how to do select or apply. I know I'm looking for things that are going up. Bradycardia, I'm going to eliminate it. Hallucination, I'm going to leave it. Hypotension, you're supposed to be hypertensive. And then you have tremor. Now, the question gives you a time. 24 hours is early signs of alcohol withdrawal. Early signs of alcohol withdrawal, yeah, you see things going up. Diaphoresis, you see it going up, but hallucination occur later. That's delirium tremor. When you get in there, yeah, this is like more than 24 hours. So this is wrong. Tremor is right. So there's only two answer choice there. You have to bring your content. This is why mental health can be very challenging, but bring your content if you know it, and then you apply it. So there's only two things: hallucination and seizures occur later on. Which finding are expected? Expected finding. It's a selected apply. Don't overselect. Selected apply. And this is caring for adolescents with anorexia. What do you see in anorexia patient? This SATA questions is designed to test your knowledge. Content is all content. You got to remember them. And that's how you do SATA. Hyperactivity. Do you see that in anorexia? Hypertension. Do you see it? Elevated BMI. Do you see it? Lunugo. Do you see it? Bradycardia. Do you see it? Or increased appetite. When they give you a SATA question, they take in signs and symptoms, they take in education, they take in treatment, and they put it together for you to pick it. Stop the video. Let me know what you should see in an anorexic patient. But I can tell you, hyperactivity is negative. It's a behavior problem, but that's not what you use to diagnose anorexia. Hypotension is a physiological change you see in anorexic patient. Their BMI is low, less than 18.5. It can be elevated. Lenugo, this is primitive air on their back that is to protect them. They usually bradycardic. Their appetite is low. Their temperature is low. Their electrolyte is low. Potassium, magnesium, phosphate. These are classic things that NCLEX will ask you on anorexic patient. This is what I put there. Which next respond, demonstrate therapeutic communication. NCLEX is going to ask you therapeutic communication, psych, mental health concept. You have to know therapeutic communication. And the key to answer the question, tell me more, ask for more questions, don't judge. Tell me more about how you are feeling. Is that therapeutic? Everything will be okay. Is that therapeutic? Why do you feel that way? Is that therapeutic? That must be very difficult for you. What is the nurse trying to do? You shouldn't feel that way. You're telling them not to feel that way. Let's change the subject. You don't want to hear what they're saying? Which one is therapeutic? Number 4. Let me know what you think. Let me know your score at the end. But like I said, as usual, tell me more is good. Everything will be okay. False reassurance. The word why make this wrong. That must be very difficult, very sympathetic to the patient condition. You shouldn't feel that way. Why should the patient shouldn't feel that way? They can feel the way they want. You shouldn't say that. Let's change the subject. You don't want to hear what they have to say? It's A and D are right. I know you get it right. And this is caring for a client experiencing panic attack. What do you do when you see a patient who is having panic attack? What is the priority? Remember, there is a word priority there. Stay with the client, encourage deep breathing, provide detailed explanation, reduce environmental stimuli, teach coping skills, and encourage decision making. There's some questions when you see it's a selected apply. If you mix certain words in the question, you overselect. You get it wrong, not because you don't know. Like I said in the beginning, I said most students know psych content, psych concept, but the problem is what? How to use the what information you know to answer questions, judgment, right? Which answer traits will you pick? And then I will explain to you. I will tell you why each of them is wrong and why the right answer is the right answer. You pick an answer. Now let's break it down. Let's see what we have. As usual, select or apply. You don't have to select everything. He said intervention. You got to do anything. But there's a priority here. That changes everything. And this is caring for a client. It's experiencing. So acute problem. Now, let me rewrite everything. What I see is acute panic attack. That patient, whatever you say, they can't listen. They will not listen. They're just anxious. All you need to do, keep quiet, stay there, and provide safety, calm and safety. Therefore, I stay with you. I'm not going to say anything. When you're talking to them, encourage deep breathing, they may not listen to you. This is not going to help with the acute situation. Provide detailed explanation. Their brain is now locked up. They're not going to hear anything. Reduce stimuli. Yeah, calm environment. Why would you teach a patient who's in acute panic attack? They're not even going to listen to you to tell them to take a deep breath. They won't. Encourage decision making. Too late. This is the end of it. We don't need to. So pay attention to the question. All these answer choices are right, but the answer question is asking right now, acute problem. So stay with the patient, safety, and then calm. So safety and calm is the first thing before everything. And then it's assessing a client receiving lithium, which findings suggest lithium toxicity. The certain condition that you have to pay attention to when you know lithium is a problem. Typical cause of cystine, polyuria, slurred speech, tremor, weight gain, and dry mouth. And whenever you hear lithium, there's certain things you have to know about lithium. Right? Lithium is very notoriously insane. The major toxicity, the first sign you see is GI symptoms. Then it progresses to neurological. So those are the key. But which of this should you worry about? I put this there to trap you. It has nothing to do with your heart rate. NAB 60 is normal. Polyuria is classic lithium. It does not indicate toxicity. That's one of its side effects, but it doesn't indicate toxicity. Slurred speech is a neurological problem. That's a problem. Tremor, neurological problem. That's a problem. If you don't deal with it, you get a seizure. Weight gain is endocrine associated with lithium. Normal finding that you see in patients with lithium. It has anticholinergic effect, lithium. So these are concepts you should know about lithium. These are pharmacology. I have a bunch of pharmacology stuff on my YouTube channel. You can watch them, and that will help you answer some of these questions. But dry mouth, anticholinergic, weight gain is associated with lithium. Polyuria is one of the nephrogenic diabetes insipidus effect of lithium. It does not affect your heart rate. So epical pulse 60 does not matter. All we care about neurological problem. Therefore, that and that. Number 7, a nurse is caring for a client in maniac phase of bipolar. Bipolar is 2. There is a depressive and maniac. Which behavior are expected? I try not to make the question too difficult because some people like try to emphasize on so many hard, complex stuff. Sometimes the NCLEX will give you some straightforward information. They look tricky, right? But when it looks straightforward, you think they're tricking you. They are not. Which behavior is expected? If it's maniac, what do you see? Slow speech, social withdrawal, flight affect, poor concentration, decreased need for sleep, flight of ideas. Connect them. Maniac. The maniac is supposed to go up. Therefore, your speech is not going to be slow. It's not going to be. Your speech is not going to be slow. If your speech is not going to be slow, you're going to have flight of ideas. That's the opposite. So many things come into your brain and you're talking. Social withdrawal. No. Maniac patient, they want to be everywhere. Flight affect. No. They will be hyper. Or concentration. They may have it, but that's not classic. They talk all the time, so the concentration will be good. It may appear later on. And what? Decreased need for sleep, right? Decreased need for sleep is key. So those are key aspects of a condition that you should pay attention to regarding bipolar patient. Which finding require immediate intervention? Selected apply. And this is monitoring a client receiving allopurinol. It's antipsychotic, first generation antipsychotic. Weight gain, blurred vision, dry mouth, shuffling, gait, fever, and muscle rigidity. What do you think I'm telling you? These are signs and symptoms of what? Side effect of allopurinol, because it's antipsychotic. But which one require immediate intervention? All of them is bad. We don't want them to occur in the patient. You pick your answer, you select yours. I know which one you're going to pick. I know you're not going to pick weight gain because that's expected. It does not require immediate intervention. Anticholinergic effect does not require immediate intervention. Dry mouth, anticholinergic effect does not require what? Immediate intervention. Shuffling gait, that's extrapyramidal side effect, does not require immediate intervention. Fever is a neuroleptic malignant syndrome. Bad problem. Muscle rigidity, bad problem. You got it? That's the way you answer this question. The word immediate intervention change everything. You may know all this, but you may overselect and pick more than 2 answers and you get it wrong. It's not that you don't know, you're paying too much attention to certain things. There's a big word in the question. Select or apply, which finding are positive signs or symptoms, which a nurse is assessing a client with what? Schizophrenia. Which finding are positive symptoms? Hallucination, flagged affect, delusion, anhedonia, social withdrawal, lack of motivation. There's 2 ways you can answer this question. Schizophrenia, when we say positive, every time you're doing mental health and they say positive symptoms and negative symptoms, positive means you had some symptoms to the individual. Negative means you subtracting, minus. So you're missing something. If you're adding something to somebody, then things that is not supposed to be there. Hallucination usually is not supposed to be there. Flat affect, you taking it from them. That's not the normal expression, right? Flat affect means you going down, so subtraction. That's why this is what? Negative symptoms. Delusion is going up. That's positive symptoms. That means you're adding something to something. Anhedonia, you're going down, so subtraction. You're missing something. Negative symptoms. Social withdrawal, you're losing what everybody does. So we're taking it from you. And lack of motivation, we're taking it from you. So this is another way to understand what positive and negative symptoms is. So hallucination, I'm adding. Delusion, I'm also adding. It's a positive. That's how you add things. And the last question. This question, testing your knowledge. Straightforward depression question. I know you got it. And this is assessing the client admitted for major depressive disorder. Which finding indicate the highest risks of what? Suicide. You see what the word, the highest risks of suicide. All of them may indicate suicide, but the highest one, select one. Sudden improvement in mood, giving away personal belongings, insomnia, I can't sleep, I have social withdrawal, expressing feeling of hopelessness, and crying and drawing assessment. Which of these indicate that, hey, I'm not going to commit suicide? Stop the video. Last one, and you know you got it. Let me know what you think. That can take you. When your symptoms goes up and improve right away, that means bad problem, suicide. If you're giving your things away, that means you're giving up. Insomnia is a classic symptoms of what? Depression. Social withdrawal, classic symptoms. Hopelessness, classic symptoms. It does not indicate you're going to kill yourself. That's what the question is going to ask. When you're crying, classic depression. Thank you for watching. 10 questions, I yield, select or apply, NCLEX practice question, SATA question on psych mental health concept. If you need more, I'm going to link a video right that will show up on the screen, or you show up at a card on top of the screen. That's more concept regarding psych. And if you need more SATA questions, also check a playlist attached to this video. Thank you very much and good luck in your exams.